thank you. Thank you for your testimony, very, very compelling, and thank you for your voice, your leadership in this very important area. I recall a visit that I made out to rural Alaska some years ago. It was a town hall meeting with Native leaders, and young people from a neighboring village had come to the town hall and asked to be recognized, and they raised the issue of suicide. None of the adults in the room wanted to talk about it. The young people, one young man said, suicide is becoming normal within our village as far as the youth were concerned, which was shocking and troubling. But it was almost as if there was a generational disconnect. The kids wanted to speak about it, needed to speak about it. And the elders in the room were afraid. They were afraid, I believe, that if they spoke about it, it might be encouraged. You have been involved in suicide prevention trainings in school, peer-to-peer. Share with me a little bit, if you will, and the committee, not only the importance of increasing access to these trainings and the recommendations for how we can reach out to kids, because again, it seems that younger and younger children are feeling these sense of depression and despair and crisis and suicidal ideation. It's important how we speak to one another so that it is heard. Can you address how we can provide for more in the curriculum that's actually meaningful to kids? How we can provide for counselors who understand how to speak the language? Because I fear that there's a disconnect there.
Absolutely, thank you. Yeah, suicide is a huge issue in Alaska, and actually one thing, Alaska does the Youth Risk Behavior Survey, and they show that the percentage of students attempting suicide has grown significantly in the past few years. So in 2019, 25% of all students in Alaska school district seriously considered suicide, and 20% of them attempted. 20% of them attempted, and so that's 1/5 of my classmates. But like, how many parents do you think knew about it? Do you think 1/5 of parents really knew that their students had seriously, attempted suicide? So one thing that prevents students from talking about it is honestly the stigma that parents have. So they never even reach the point of asking out or asking for help because they doubt and diminish their experience. They don't believe anything is wrong. They're scared. They think their family will crack jokes or not take them seriously, or they expect their parents to blame themselves. They're afraid they'll be seen as weak or crazy or attention-seeking, wacko, broken, a lost cause, any of those things. So reducing stigma in general, one of those things that we can do, like in Alaska, what we're trying to do is pass a bill that would help bring mental health education into K-12 schools. So by talking about mental health in schools, specifically in health classes, we begin conversations early and allow space for people to share. So health classes currently cover topics like nutrition and physical health, exercise, dental health, all these sorts of things, cancer prevention. And mental health deserves to be a topic in one of those classes. It's just as important. And guidelines for this kind of curriculum would be developed with local and statewide and national agencies to make sure it was safe and age appropriate. And of course, we wouldn't be teaching the same thing to high schoolers as elementary school kids, but it would help you, see symptoms and recognize them and know what to do about them and reach out for help. So that's one really important thing. Also in terms of suicide prevention, just like clubs like You Are Not Alone Club that does suicide prevention trainings in schools and goes around to classes and talks about it. That's a really important thing too. So all of those things working together.
Thank you, Claire. Madam Chairman, I'm almost out of time, but I think every one of the witnesses in one way or another has talked about the need for workforce, and whether it is school counselors, those that can work with kids in programs, or whether it is all the way to the other end with a full psychiatric care that is available. And my hope is that we build out a package of focus on mental health. We really key in on the workforce issues because I think we recognize that in all our states we are sorely, sorely lacking.